Excellent. I'm going to go ahead and kick it off. Thank you so much for joining us today for this program that features both Seqirus Pharmaceuticals as well as Families Fighting Flu. And what a great time of year to make sure that we're getting a positive message out there about our opportunities to head off a pretty dangerous disease that comes around every single year and never really goes away. But maybe with perhaps new attention and new importance with the COVID that is stealing all the press that's out there. All of us in MOBIO, across the life sciences community, and our friends, we don't want to be patient zero to anyone else. We don't want to get sick, but we also are leaders that oftentimes our neighbors, our colleagues, our coworkers, people that we influence, they want to know a little bit more about the science side of things. They want to know about the patient advocacy groups and where they're coming at from these. And so since my primary care physician started preaching at me in September, you get back in here October 1st, when Roy Pura with CSL Plasma told me about this potential program. Our MOBIO leadership jumped all on it, and we said, we are thrilled to feature this up. At the beginning of this program, we also want to make sure that you know that on October 27th at 10 a.m., we will have a kind of a sister program to this. We felt that they were two distinct topics that we wanted to break out. And so next week on the 27th, you'll have a chance to register and participate on a program that is going to bring attention to plasma and its role in developing into a therapy, an antidote, using some of those antigens for COVID prevention. So keep an eye out for any emails that come from myself, Michelle Lumpkins, or Lisa Zimmerman, your MOBIO team. And we're thrilled to see so many friends across the MOBIO spectrum join us today. And with no further ado, it's my honor to introduce Serese Marotta. And Serese is the COO of Families Fighting Flu. And I'm going to get this wrong, but Serese is either in Arlington or Dayton, one of the two. I'm taking a guess there.
I'm not, but I can rectify that. I'm in upstate New York.
You fix it, okay? Don't let my facts get in the way of your truth. And we're delighted to have Serese bring her story about her organization. And I think you're in for a real treat, as well as some real strong information. Serese, thank you.
Thank you, Kelly. Yeah, it's kind of like Where's Waldo with me. So I am actually physically in upstate New York. Families Fighting Flu address is in Arlington, and my cell number is Dayton, Ohio. So I can understand why you were confused there. So as Kelly introduced so kindly, I am the Chief Operating Officer of Families Fighting Flu, a national nonprofit organization. And I'm going to talk a little bit about that, but almost more importantly, I am here today to give you the why. And not only am I the COO of Families Fighting Flu, but I am a parent advocate. So next slide, please. So just to lay the groundwork, and I apologize for my printer inevitably going off right now. Most of you probably know these facts. If not, hopefully maybe this is new for some of you. But just to kind of build upon what Kelly was talking about, flu is a tremendous public health burden. We know the CDC just released the statistics for last flu season, We had 22,000 deaths in this country. We ended up with 192 pediatric flu-related deaths, which is 192 too many. On a global scale, we know influenza has a tremendous impact. And we know that we're still trying to convince people to get vaccinated. So we know it's not just about us as individuals, but for the greater good that we're getting vaccinated. Next slide, please. So this is my why, and this is perhaps the most important thing I'm going to share with you today. This is my story. The pictures that you see in front of you right now, this is my son Joseph in October 2009. So if you look at your calendars, that was actually during the H1N1 pandemic. Joseph was a healthy 5-year-old boy. He was in kindergarten. He loved Star Wars and Transformers and puzzles and cars. And he was smart. He was affectionate. He was funny. And he one day became sick. Very innocently, his illness started. He threw up on the school bus one day, and we went and picked him up. We brought him home, and he's our second child. So I think with our second child, you know, you don't become as alarmed when they get sick. So we brought him home. We're monitoring him, and he became really lethargic throughout the day. And that was really what prompted us to call the pediatrician and say, you know, something's going on. He's vomiting pretty much intermittently throughout the day. He has a fever, but what's most concerning is he's really lethargic. So it was after hours. So they actually suggested that we go to our local urgent care. And we took him there. And when we brought him in, the nurse took one look at him and said, I bet that kid has the flu. So they did a rapid test on him at the urgent care. That rapid test came back negative. And they ended up checking his blood oxygen levels, and they were low. So they said, okay, we've got to throw him in the ambulance, and he's got to go to the downtown Children's Hospital. And we were living in Dayton, Ohio at the time. And we got to the hospital that evening. They did a PCR test on him for influenza. That did not show anything. And eventually they diagnosed him with pneumonia. So he was in the ICU for a couple of days. And, you know, of course, started with the antibiotics, the steroids, the breathing treatments, all of that. And eventually, you know, 2 days later, they downgraded him to the regular pediatric floor, because at that point in time, he was breathing on his own. He didn't require any oxygen. So down to the pediatric floor we go. And his condition was relatively stable. Mind you, he was still throwing up intermittently. He had a fever. He was on an IV. But for all intents and purposes, his condition was stable. So throughout that week, he was in the hospital a total of 10 days. Throughout that week, there were a lot of specialists coming and checking his different target organs, you know, cardiologist, nephrologist, pulmonologist. This kid was getting checked over head to toe. We were continuing with his treatments, with his therapeutics. And a couple days after we were on the pediatric floor, the doctor, who happened to be the chief of infectious diseases at that hospital, came to us one day and said, this is so strange, but Joseph's culture is growing influenza, but not a big deal. Don't freak out, because we know H1N1's out there, but it's just like any other flu. We'll start him on antivirals. Not a big deal. So we kind of progressed throughout the week. Joseph had a couple hiccups along the way. He started complaining of belly pain. They were worried about gastritis, pancreatitis. So more tests. Again, everything looks fine. The 9th day, my husband and I had to trade off because of the no visitation policy at the hospital. And it was a Saturday morning, and I left with our then 7-year-old daughter, took her home. My husband stayed. And later that afternoon, when I returned to the hospital, my husband said, you know, you got to bring our daughter up. Something's going on with Joseph. So up the elevator we go, masks on. And I remember walking into the hallway, and the nurses seemed somewhat frantic. And that was the first time, he had at that point been in the hospital 9 days. That was the first time my red flag went off and said, something's not right here. And what had happened is Joseph's blood pressure had plummeted so low, they couldn't get a read on his blood pressure. So back to the ICU we go. Again, we think he's relatively stable. We just can't figure out what's going on with the blood pressure. And they started running more tests. We were so comfortable that my husband ended up leaving that evening, took our daughter home. All through the evening, Joseph is alert, he's lucid. We're talking to him, and they're running tests, and they keep communicating with me. Everything looks okay. Fast forward to about 6 o'clock in the morning, October 18th, 2009. The attending physician came to me and said, I want to put Joseph on a ventilator only because they weren't able to rectify his blood pressure. And because of that, his respiration rate and his heart rate were very elevated. So we just want to make him comfortable. We're going to put him on a ventilator. I was very calm. Again, there was no urgency. It was not posed to me that this little boy was critical. So I called my husband very calmly, told him to come up. Moments later, I was talking to Joseph. He had been awake the whole evening as they were poking and prodding him. We were talking about Halloween costumes, and he suddenly coded. And I remember all the doctors and nurses rushing in, and I stepped out of the way to let them do their job. And I stood in the hallway and I waited. And several times they tried to bring me back into the room, and I walked in and saw my precious little boy laying on that bed with people working on him. And I backed back out of the room, and I thought, okay, they're going to fix this. And the short story is they didn't fix it. That morning, they worked on my son and tried to revive him for over 35 minutes. And he ended up passing away. And as I stood there in the ICU, holding my son's body, my son, who I thought was going to come home with me, I remember the attending very clearly saying to me, the attending physician, he's the 85th child to die from flu this year. And here I was an environmental scientist. I was educated. I was a protective parent. I thought I knew everything that I had to know. And I looked at her and I said, what are you talking about? People don't die from the flu. I had no idea. So as a result of Joseph's story, I, about 6 months after his passing, got involved with this organization, Families Fighting Flu. And, I think one common theme of the families that are part of this organization is that we have been personally affected. There are stories not just of loss, but also survivorship. We have been personally affected. And our goal at the end of the day is to share our stories and to educate and advocate in hopes that other folks don't have to have this same experience. So next slide, please.
And Serese, I know that's a critical part of your slide deck, but 11 years, 3 days ago, it sounded like yesterday. And we are sorry that you have that part, that beautiful little boy in front of those palm trees looked healthy as a horse.
He was. And I think that's a really important point, Kelly. And it's one that is not unique to Joseph. Joseph was healthy. And people, when I tell his story, they want to say, okay, well, what was wrong with him? Was he high risk other than being a young child? Did he have asthma? Did he have diabetes? Did he have, I've heard it all. And time again, I said, no, he was otherwise healthy. So important, because our stories here at the organization illustrate that flu does not discriminate. It does not matter your age, your gender, your lifestyle, your ethnicity, your health status. Unfortunately, flu can affect any one of us in a really severe way. So just briefly, because I want to be respectful of time too, Families Fighting Flu has been around since 2004. It has been a saving grace for me because I needed to do something with this tragedy. I couldn't just curl up in a corner, and I needed to make a difference. I needed really, and I still do, and this is my main job, to educate and inform others so that they know what I didn't. That's the most important thing. I've always been pro-vaccination. Joseph was vaccinated with the seasonal flu vaccine that year. We know the pandemic strain of H1N1 was not in it, but I want people to know what I didn't. So Families Fighting Flu, that's really what we do. We strive to educate and advocate. We are made up of many families just like mine. We have a board of directors, we have medical advisors, because I always say, as much as I know about flu, I do not have a medical degree. And really a very important part too of our organization is our staff and volunteers and advocates. And we have advocates across the country who not necessarily have been personally affected, but have joined our organization in hopes of elevating that awareness. Next slide, please. So just really quickly, this is just a snapshot of some of our projects that we here at Families Fighting Flu are doing this particular flu season. Our Flu Champion program is really focused on our advocates. How do we mobilize and empower them at the community level to do that education and advocacy with our support? As far as our communications are concerned, social media, digital media, earned media are all super important, and they continue to be important for us every year. And this year, something that we're doing that's a little bit different than what we've done in previous years is we're working with schools and employers to actually facilitate on-site flu vaccination programs. So that's to date been really successful and something exciting. And we're also, for the maternal immunization project, we're partnering with some folks in New Jersey to get the word out about not just flu, but for pregnant women, we also know that Tdap is a concern and their rates are not where they need to be. And earlier this year, we also did a national consumer survey, because in light of this crazy pandemic that we're all in the middle of, we wanted to really get a pulse on people's knowledge, attitudes, and beliefs around not just flu, but COVID, and how is the pandemic affecting their knowledge, attitude, and beliefs, regarding flu. So that really helped us gather a lot of data and inform our efforts for this flu season. And then our flu vaccination promise is just that. It's actually a really simple pledge program that we came up with this year that's on our website. And we're just asking people to pledge and promise to get their flu vaccine this year. And I think last I checked a couple weeks ago, we had over 700 people who had signed up and pledged to get their flu vaccine this year. And then we're also doing a pilot texting program, which is another type of reminder program, because we know life is busy. And sometimes the people that don't get a flu vaccine, it's not because they're against it, it's because life is busy and it falls off the radar. So our target audiences are really, in short, everyone that's out there breathing, which is no small task, but we really want adolescents, parents, adults, seniors, pregnant women. We want everybody to get the information that they need to feel empowered to make that decision about flu vaccination for themselves. And understand that flu prevention is a team sport. Again, vaccination is not just about us as individuals. Next slide, please. And this is just a snapshot, a collage of some of our families. Right now on the website, I think we have over 55 families that are featured. Again, not all sad stories like mine. Certainly there's a lot of stories about loss, but also stories of survivorship. Healthy people who became really sick with flu, hospitalized, some near death, but thankfully surviving. And again, the goal at the end of the day is to share our stories, share the education, including evidence-based information, because I love data and statistics, and they certainly have a place in the conversation. But we really share the stories because these are relatable. People see this, and if they can relate to it and someone's on the fence about flu vaccination, we have seen firsthand that the sharing of stories can really change their mind about getting vaccinated. Next slide, please. And this slide is just it's a it's a statistic about a statistic, which I can appreciate being a former scientist, but stories are 22 times more memorable than statistics. And this actually comes from a psychologist by the name of Jerome Bruner. And again, the data, the statistics, the facts, the evidence-based information is certainly important to share and to continue sharing, but the stories are relatable. And so I think this is kind of an interesting thing to remember, that it's fine to pump out all that data and statistics, but tell them a story because they're going to remember a story. And then the next slide is just my contact information. And if anybody wants to reach out to me personally, follow us on social media, visit our website. Happy to entertain any discussions and provide any assistance that we can here to you at the organization. Thank you.
Thank you. And Serese, if you'll, actually, Michelle, you're going to load up Dr. Anderson's.
Yep.
And Dr. Anderson is the Senior Medical Director for Seqirus. And it says lessons learned from the Southern Hemisphere. And he's got an Asia-Pacific title, which makes some of us perhaps a little jealous that he might be in the Hawaiian Islands from time to time.
I wish, but only on vacation. So thank you very much. And thank you for the opportunity to perhaps just talk about some of the lessons that can be learned from what happened in the Southern Hemisphere at the time when we were hit by lockdowns associated with the coronavirus. But next slide, please. Well, I think what's really important is to understand that I work for a company, CSL, which Seqirus is part of. And what our focus is every day is stories just like what we've heard. We want to stop people from getting influenza. We want them to stay well with other immune diseases. And everything we do is focused on people and prevention of serious illness. And so I think it's really important every day to remember the patient, the person that's at the end of what we do. And so as an organization, we're based around the world. We have facilities in the United States, in Holly Springs, in King of Prussia, in Kankakee. And as CSL, we focus both on plasma and on vaccines. Next slide, please. So when we're talking about this, we're talking about what happened in Australia around the time of coronavirus. The first time that the lockdowns hit us, which was around March, and our vaccination season is usually March. Now, Australia is a big country about the size of the continental United States, with a population that's somewhere between Florida and Texas. So we have every year a distribution of vaccine that goes out through a whole range of different providers to ensure that we don't have influenza. But this year it was particularly important. And we have recommendations around risk groups, including children, to make sure that we cover and prevent illness. And our peak season for flu is usually August and September. It's usually just tailing off last month. Next slide, please. And so what happened with COVID? Well, we had lockdowns in March. Now, you might think that these numbers look quite small relative to what you're all experiencing in the United States. We have the great advantage that we could close our borders completely in March. So people neither could leave or arrive unless they were willing to go into 2 weeks quarantine. But this hit at the start of the influenza vaccine season. And so the disruptions, the lockdowns, the shelter in place hit acute healthcare, it hit vaccinations, it hit plasma donations, which was a really important part of our healthcare system, as well as routine care. And it meant that we needed to initiate telehealth. And we've really had 2 waves of infection so far in our country, with the second wave just coming under control. So how did the government react, and how did that impact on influenza? If we go to the next slide, please. What we saw was that the vaccine programs had very strong, very early demand, and we had an increase of 36% relative to the previous year. So that we've ended up with more than 50% of the adult population and greater than 80 or 85% of over 65-year-olds being vaccinated against influenza, many for the first time. We had huge impacts on supply chains. Remembering the size of our country, it's not trivial to get vaccine everywhere. And so we, as a vaccine-focused company, went back into production to produce more vaccines for the need, for the demand. And this is what we've also done this year as Seqirus in the United States, is we produced more vaccine than ever to try to meet the demand that we knew was going to be out there for the Northern Hemisphere. But there was a need for lots of local solutions to deliver the vaccine programs. Next slide, please. And these included drive-through clinics, which we've never seen before in Australia, where people stayed in the car to have their vaccine. We saw vaccine clinics set up in the front yard of medical clinics. We saw them set up in community halls and church halls. We saw them set up on a Sunday when people didn't usually go to see the routine care, just to be able to try to make sure the whole population got vaccinated. And I can emphasize these responses were local providers responding to the need and moving to be innovative and to provide these vaccinations in the face of huge lockdowns, in the face of constraints around being vaccinated. Next slide, please. And also we saw the government respond. And so we had the formation of what's called the National Cabinet. And this was both federal and state leaders. So our federal Prime Minister, who belongs to one political party, and the state leaders, some of whom belong to his party, but actually many of whom belong to the opposition party. They formed a national cabinet and declared a state of emergency and worked together pretty well. You know, there's some fragmented stuff going on now, but really through the worst of the first crisis, they really operated together. But they also changed the flu vaccine mandates. They made all healthcare workers get vaccinated as quickly as possible. They made everyone working in aged and childcare get vaccinated, and everyone visiting an aged care facility. So if you wanted to visit your grandmother in an aged care facility, you had to be vaccinated by May the 1st. We had the early start to the immunization program. They got on with it quicker. And we, of course, had widespread testing and tracing for coronavirus infection. But the flu messages were very strong. Next slide, please. And these messages were consistent. And I think one of the lessons we learned as a country was having this consistently between the political leadership, which is there, our Prime Minister, our Health Minister, as well as our Chief Medical Officer and the Australian Medical Association and all the state leaders. They said, get vaccinated against flu. They said, we may not have a vaccine against coronavirus yet, but we do have one against flu. So this will reduce the need for individuals to be worried about flu, as well as prevent the health service being overwhelmed with a twindemic of flu and coronavirus at the same time. And this achieved a very high level of influenza vaccine coverage. If we go to the next slide, please. So we learned something, so we also as a company responded, and CSL Seqirus has been testing vaccine candidates in collaboration with a number of investigators, including a group from the University of Queensland, which is currently in phase 1. And as CSL, we're also developing in partnership with other plasma product manufacturers, hyperimmune immunoglobulins as part of a global alliance. And as well, we're looking at new ways to get immune plasma from cows, which is a really novel way of operating with a small company called SAB in the United States, as well as looking at monoclonal antibodies as potential treatment for disease. Despite all these initiatives, we remain focused on the importance of seasonal influenza vaccines and the potential for pandemics, of course, in the future of influenza, as well as responding to this current pandemic. So if we go to the next slide, please. And what did we learn? Well, we learned as a country that we're going to be expanding target populations. We have to think smartly around how we deliver these programs in the face of a pandemic. And we're thinking about this for the rollout of coronavirus vaccines. We need to communicate really clearly and retain some consistency and not fight as we communicate. And there are sustained policy changes needed in the prevention of infectious diseases, including influenza. We need to make sure that we prepare for pandemics, and prepare is the key word here, because having plans and responding quickly is helped a lot by preparing beforehand for the eventuality that we may have pandemics. Overall, while our lessons may not all be transferable to other jurisdictions, to the United States and other countries, we hope there are some things that people can learn from the experience around communication, around innovation, and around responding both as a company, but also as a community. So thank you for your attention today.
Thank you, Dr. Anderson. And thank you, Serese. Two very timely questions. We had a lead question come in from Robert Blaine over at Washington University in St. Louis, and he wanted to ask, and Serese has already answered, and thank you for doing so, and I have forwarded that to Robert, but he said, I wondered if you could speak of the challenges of getting public acceptance of vaccines, whether for flu or COVID-19 when available, and what messages and strategies prove more effective in getting widespread compliance for a vaccine program, particularly with the skeptical United States public, and what entities, institutions are key in executing these messages and strategies. Just yesterday, I heard from the president CEO of BIO, Dr. Michelle McMurray-Heath, who said that already 2 governors have announced an additional review step. If and when we ever get a COVID vaccine, they want their state governments involved in giving it a blessing for their state publics. And that's out of New York and California. So all of us are wondering that same question of how do we lean into this and share tangible, believable, science-based information to help the public see the wisdom of this.
So would you, Kelly, along with what Serese's already said, which I agree with, I think it comes down to understanding why people might be hesitant, why they might be worried, what is the rationale or irrationale for those fears or those anxieties or those concerns, which I think we have to both empathize with and then try to address in ways that are appropriate for the particular concern. I think I see, and this is just my view, that vaccine hesitancy has been a spectrum between those who are opposed to vaccines because they kind of ideologically opposed to the concept of vaccines, and the majority of people who have vaccine hesitancy who are just concerned, anxious, scared, perhaps heard something that worried them, naturally wanting to protect their family. I mean, that's what we all want to do. We'll all step in front of that truck to protect our children. We want to make sure that we empathize and understand the particular reasons. And before I joined the industry, I was a primary care provider, particularly interested in infectious diseases. And I've always felt that the most important thing is to ask the why of people's concerns around hesitancy for vaccines or treatment or diagnosis. And as a provider, that's what we can do, is try and empathize. But as a community, we can also try to think about not labeling people for their hesitancy, but actually trying to work to create clear messages that are both rational, but also speak to the irrational side of ourselves, which is are important factors, the emotions that go behind vaccination. And I think when we think about coronavirus, I think it's a great example of a disease that we don't have a vaccine for and just how bad it is. Whereas I think flu, we have a vaccine. The vaccine may not be perfect, but it does certainly reduce the chance of acquiring flu and reduce the chance of becoming sick with flu substantially. And that's an important part of a general program of vaccine of influenza prevention. So my slightly long-winded answer says, go to the trust that you need to build with communities and populations. I see, for instance, that people of color in the US are particularly less likely to consider having the coronavirus vaccine. Well, how do we need to work with communities, with their leadership, so that the messages are coming through, so that they understand the need and can communicate with the people they're working with. So that's how I would see it.
And that tells me in a succinct way to give up the name calling and referring to the non-believers as Luddites. We'll put that on the back burner for the moment. And
yeah. I mean, there are some non-believers, and that's fine. They don't have to. No one has to believe what I believe, but I think we could separate out some of those reasons for vaccine hesitancy, because we always think of the ones who are the noisy ones, who are it's ideological. But actually, I'm more interested in the quiet, the mother with 3 children who just doesn't want to do it because she's scared of it. And I want to speak to her because she's the one to address. But Serese, you might want to add to that.
I totally agree with you, Dr. Anderson, and I was shaking my head as you were speaking. I definitely agree that we have to build that trust in people, and the way we do that is, by letting folks know it's okay to have questions and concerns, and that's what we do here at the organization. We're not here to be your judge and jury. We honestly want to get you the information you need to, again, make that informed decision. So for us, it's really, to put it in a short way, empowering them, right? And I think it's all about presentation, because when I share my story, I frequently will say to folks, I'm not going to run down a dark alley after you with a syringe in my hand. And I kind of joke when I say that, but that's really the grace that I present my story with is well received usually, because they understand I'm not necessarily trying to tell you what to do. I'm listening as much as I'm talking. And it really is astounding sometimes. Doesn't work every time, but as Dr. Anderson said, for those folks that fall in that vaccine hesitant category, it's astounding sometimes how well being compassionate and empathic can get you into that dialogue and have that movement.
we had another question that came in that asked whether the precautions that we're all taking for COVID are going to make for a less severe flu season, or the fact that, many of us are piggybacking that flu vaccine when we're kind of automatically going in to see our primary care physician, and because we're doing social distancing and only going in when necessary, is that a worry for folks not picking up the flu vaccine and perhaps us having a double whammy?
Well, certainly if the experience we had this year, we've had very low rates of flu, and what we have no data yet why that happened, but there are a number of factors that may be very critical in this. Certainly, we had our borders closed, and we know that obviously the flu arrives usually from somewhere because it goes away mostly through our summer, and so the thought was that there's no kind of technical terms, no force of infection going on from people returning from vacations in countries where the flu has been going on. So that maybe is one factor. Another factor certainly was the lockdowns, and we had pretty good adherence to those. as well as mask wearing, which again, in most of the states has been a lot of people have been wearing their masks. But you can't go past, in my opinion, the fact that we had such high pickup rates for influenza vaccination this year. And that it's a public health is a multifactorial game. You don't ever believe it's one factor. It's usually a combination of factors. And so while it would be nice in the United States to see a low flu season, you can't predict that because our factors are going to be different to yours. You have 50 very different states with land borders and air borders that are not completely slammed shut to everyone, with people moving around. And so the chance that the flu can take off is still there. It hasn't gone away. But Serese, do you want to comment from your perspective?
Yeah, I agree again with what you're saying, Dr. Anderson. And I think for us, the concern here at the organization is, we're hearing a lot, and the frequency of what we're hearing right now is going up, is why do I need a flu vaccine if I'm wearing a mask? Everybody's pressuring me to wear a mask. I'm washing my hands, I'm wearing a mask. Why do I still need a flu vaccine if I'm doing that and I'm social distancing? So it's almost like that sense of complacency. So you have to take the conversation beyond that and say, yeah, keep doing all that stuff, because that's going to help mitigate flu and COVID-19. But we still have to impress upon them that that is not a replacement for annual flu vaccination. So it's an interesting dilemma. And again, I think just going back to the clear, consistent communications, being transparent with folks, but letting them know that, this is something we still need to do. And I will say, anecdotally, we have heard here at the organization that flu vaccination rates are increased this fall, which is great. Because we were kind of, I think, all sitting on the edge of our seat, like what's going to happen, and we're still waiting to see what happens with flu. I think I just saw a media report that there was an older person in North Carolina that just died from flu. So you see one flu season, it's so unpredictable and hard to say what's going to happen here, even with the information from the Southern Hemisphere. We just have to keep our guard up and keep convincing people that we need to be taking all of these measures.
And I think the other point that you just touched on is people going and getting the flu vaccination. We know there's lots of different channels for that. We know there's pharmacies, we know there's providers in primary care and other settings. And certainly from our perspective, we're anticipating a bigger flu season. We of course, I think one of the things that all the providers are thinking about is how they might deliver this, how they might get these vaccines out there. And I think that's fantastic, because we do want to make sure that in the midst of dealing with COVID, we're not dealing with influenza at the same time, both for individuals. As individuals, we don't want to have the flu and worry that we've got COVID, but also we don't want the healthcare system to be even more burdened than it currently is. And flu vaccination is an important part of prevention of this happening.
Yeah, I definitely think people are worried about, going out. If those folks are, they've been hunkering down for months, and now they're like, you want me to go out and get a flu vaccine? So yeah, it's really important that we're communicating those alternative options for them, because I know a lot of healthcare providers, whether they're doing, the curbside stuff, or there's, drive-through clinics going on, pharmacists obviously are important immunizers in this space. So just making sure that, again, we're pushing out that information to people so they know what's available to them, because I do agree access could be a limiting factor for some people if they have preconceived notions about it.
Got a really strong question that came in that I'm going to ask us to hold off on for a week, because it deals a little bit more with COVID vaccine and COVID vaccine acceptance and selling it, and knowing that it may take several years to test and perfect such a vaccine. Let's save that one and talk about it next week on the 27th. We had another great question that said, to try and align with strategic partners across the life sciences in regard to consistent communication. Is there an educational site beyond Families Fighting Flu, or parts of it that all of us could point to for explaining how the vaccines work from a real science standpoint? And maybe it could have complexity levels from simple to advanced research science explanations. Would either of you like to address that for us?
I can jump in first, and then I'm sure Dr. Anderson has some enlightening things to share too. I can obviously only speak for our website. What we try to do here at the organization is, we're kind of that unbiased resource for folks, and health literacy levels are super important. I can't tell you how many people have come to me and said, I looked on the CDC website, and I love the CDC, but I looked on the CDC website, but I still don't understand what they're talking about. So sometimes, the technical jargon is still a little bit too high for folks. And when we develop content for our website here at Families Fighting Flu, we try to really distill things down so that they're easily digestible by the average consumer. Sometimes we do it well, sometimes it's a little bit harder. I can tell you personally, I struggle with trying to explain vaccine effectiveness in a way for the general person to understand it. But beyond our organization, I'm not sure if I know off the top of my head. I know state health departments, county health departments have a lot of great information. The CDC is great. Again, the health literacy levels may be a little bit high for some populations, but just to kind of, we try to make sure that we're speaking to the masses, because that's really who we're speaking to. We're speaking to the general public. Many of us are parents, we're talking to other parents, and that's really what we strive for at the end of the day here.
I understand the immunization coalitions, the immunization action coalitions is also another good place that people can look. I think it's important to have different channels. In the end, they're all going to say similar messages around the need for flu vaccination, but they may speak to different populations in different ways that resonate with them. And encourage, I think, the immunization action coalitions. We've certainly, I've had an opportunity in the past to speak to their leadership, and I think they do a super job in also promoting the idea, along with the CDC, who obviously take a leadership role within your country.
I've yet to see the scientific proof that dispels that flu vaccines can't give us the flu. We might get a sore shoulder, a bruise, we might not feel great, but we're not knocked on our rear for a week or two at a time, becoming super religious, and calling out to higher power to stop what the flu symptoms that we're encountering.
Yeah, I mean, I think there's always a misunderstanding of what flu is. Flu, I always used to say in practice, that's the common cold. That's what you got. Flu lays strong people flat, and you'll really know when you've got the flu because you feel dreadful. You feel awful. It's not a mild disease, and as we've already heard today, it kills children every year in United States, nearly 200 children every year in the United States, and a host of older people. And so this is a infection that we can do something about, which is a flu vaccination.
I'm going to reach out to our audience. Any unfiltered questions or any personal stories you want to share, because as we heard earlier, it's the stories that make it relatable and empower us to convey actionable benefit to those that are in our zone. And yes, Charlie, I'd love to have you share briefly, and I think it would help.
Well, thank you. This is a topic near and dear to my heart, because about 2.5 years ago in January of 2018, I had an experience that is probably similar to what you might read about on Families Fighting Flu. I was actually in Jeff City at a lobby day. Came back home to St. Louis on a Friday night. Felt horrible with influenza A for a week. But then something went really wrong. Went to the hospital, was in a medically induced coma within a matter of about half an hour. I was in a medically induced coma for a week and a half. It was the flu that led to pneumonia, sepsis, septic shock, and organ failure. Was on dialysis, a ventilator, and very close to going on ECMO to take over the function of my heart. Ended up spending 58 days in the hospital. Got to live in the same nursing home as my grandmother for 3 weeks. That was unexpected. And that was just an experience that, well, one, I recommend against. So it's one that I've kind of shared my story because one, you don't want to experience that at all. Two, you don't want your family to go through that. My brother got a call from my mom saying, "Hey, you need to fly back home. You may need to say goodbye to your brother." Nobody wants to go through that because I think it was honestly harder for my family to walk through that with me than it was for me. And there's also those around us that are immunocompromised that we want to make sure that we get the vaccine so that we can protect those folks that can't get it and that are at higher risk. So I think those are kind of the things that at least I think about when reflecting on what I went through.
Thank you, Charlie. That really stuck with me when you went through it, and I remember you hitting Twitter and saying, "Come on, people, do the flu shot and do it now. If you don't believe me, I'm in my 30s. It's not fun to live in a nursing home for rehab.
It's horrible.
And you would have never got the sepsis, but had you got the flu."
Yeah, and it's one of those where, you know what, if you get the flu shot, you may still get the flu, but it's going to reduce your symptoms. And man, I got to tell you, I would have liked some reduced symptoms. I didn't get my flu shot that year. I just hadn't been in the habit. And let me tell you, I'm in the habit now.
Serese, you got another voice here in Missouri, in St. Louis.
Yeah, I know Charlie's name actually, and he chatted me, and I was like, I thought that was you. So yeah, I'm very familiar with Charlie's story. So, and obviously he's very well spoken, and thank you for sharing, Charlie, because it's voices like that we need to keep, elevating those stories that people know. I mean, look at him. Looks like a perfectly healthy adult, and he was taken out. So.
Yeah, perfectly healthy. Man, you don't want to wear nothing but a hospital gown for 58 days. That's just not good. Way too many people saw my butt. Just don't do it. Get a flu shot.
You are not nearly as cute as Joseph. Sorry, Charlie.
Yeah, nobody wants to see that.
I'd like to hand this off to Roy Pura, who works with state government relations with CSL Plasma. And Roy is also on MOBIO's board of directors. So he's one of those handful of bosses that I better pay attention to. And would you lead us into the next chapter that we're going to be discussing next week, Roy?
Sure, I appreciate that, Kelly. Thank you very much. And for Serese and Dr. Anderson, thank you so much for the information that you shared with us today. This was a very informative program. Serese and Charlie, thank you for sharing your stories and continuing to share your stories and how influenza has impacted you and your family. So certainly do appreciate that. And for you, Kelly, and MOBIO staff, for Lisa and for Michelle, thank you for hosting these MOBIO breakthrough programs. Since the series started several months ago now, these programs have been very informative. And I think if you participated with us here today, or going to be listening to us on the archives, I think this program today certainly did not disappoint. So thank you all for making this program happen today. As Kelly mentioned, I wanted to get a plug in for next week. Please join us next week for part 2 of CSL's contribution to this MOBIO Breakthrough series when we welcome Dr. Toby Simon. Dr. Simon is the Senior Medical Director for Plasma and Plasma Safety at CSL Plasma, where he'll be discussing industry collaborative efforts to utilize convalescent plasma to develop a treatment for COVID-19. So please do join us next week. That's Tuesday, October 27th, 10 a.m. Central Time. And I'm sure if you haven't already received it, MOBIO will be sending out an invite to the program. So that's it. Thanks, Kelly.
Roy, we're also going to start a All Things Considered podcast, and you are the voice of that now.
Thanks. I've got a voice for radio.
That was a great wrap up. So many friends on that tuned in this week. I miss all of you, seeing you in person, And but again, MOBIO is not going to be pointed at as patient zero for either influenza or for COVID. But we are going to continue to be active on your behalf and engaging with you. And I invite you to rattle our phones and reach out to us by email and text, because you are MOBIO and we can't do this without you. Everyone have a great day. And Dr. Anderson and Serese, thank you so very much.
Thank you for having us.
Thank you very much for the opportunity. Goodbye now.
Goodbye.